Hi, I'm Karen. I'm going to be your nurse today. I just want to check your name and date of birth. Okay. Just want to check Hendrick's date of birth as well. Good. Okay. Let me just give him back to you. Okay. I'm here to go over how to put on a diaper and also just some information I wanted to give you about the circumcision because I know you haven't made a determination on that. We'll also go over some information on how to take care of his umbilical cord. So um, I brought this for you. This is just some information about a website that has some great info, questions, answers, things like that for circumcision. And if you have any questions after you watch the video or Hendrick's father, just make sure you give me a buzz on your call light, and I'll come in and we'll talk to you about that. Okay. So just so you know, it's not required for you to do a circumcision at all, but if you do decide to do it, it can be here at the hospital, or you can choose your own place in order to get his circumcision done. So, anyways, as far as changing a diaper, I don't know if you've done that before, but the first couple of diapers in the first couple of days, you'll probably see between like 2 and 6 diapers that might be wet, and then about 6 to 8 every day after that. That's important to make sure that you keep an eye on how many diapers he has, because we want to make sure that we keep him hydrated. Okay, so next thing, since he's not circumcised, we don't have to deal with this now, but you'll just want to keep his penis clean with just some water, warm water, any white visible matter material. Just wipe that off. There's nothing to worry about there. That's just from birth. And just don't forcibly pull down the foreskin to clean it. Just dry by patting the area after you've cleaned it, and just make sure that when you change his diaper that you're taking care of the umbilical cord, which we'll go over now. Okay, so the umbilical cord is something that will dry up in the first few days, but you want to inspect it for like redness, any kind of discharge or swelling. And that's important because we want to keep it free from infection. Okay, so you'll clean the area with water and just gently dry it. Just keep it open to air. When you put the diaper on, you want to make sure that you kind of keep a fold down in front of the diaper and away from the stump. And if it dries up properly, it'll only take about 2 weeks before it falls off. If you do choose to do the circumcision, there's a couple of things I can go over. It only takes a few minutes for the circumcision altogether, and the doctor will give like a local anesthesia to block the pain. We're going to keep them warm and sterile, and we're going to use a clamp in order to remove the foreskin of the penis. So there will be a gauze that will keep applied to the penis for at least 24 hours. And what that's going to do is keep the skin soft so it doesn't dry up, and so it doesn't adhere to the diaper. And then every time he has a diaper change, you're going to want to reapply some of the Vaseline with every diaper change for the next week to, like, say 10 days. And if stool gets on it, then you'll just rinse it with like warm soapy water to remove it, and then gently pat it dry. Again, add the Vaseline. You want to keep that skin moistened, and so that the urine doesn't affect it while it's healing. And we can certainly give him some Tylenol for any pain that he may experience. And one of the things that we have to make sure is that he continues to urinate. That's going to be an important point you'll want to make sure of. You'll check for bleeding and redness and, like I said, swelling. That's the kind of thing that could show that there possibly is an infection. If there is an indication of infection, you'll want to make sure that you call the doctor. If there's any bleeding, you can just use a gauze square and just like gently pat it off. Don't put a lot of pressure on it, but put a gentle amount of pressure on it until the bleeding stops. and then call the doctor if it doesn't stop. You'll only use water to clean because wet wipes, they have alcohol in them, so you want to make sure that you don't use those because they can sting his little body. And then of course, after you're done cleaning the circumcision site, again, you'll put Vaseline on with every change for the next week or so, and only sponge baths until the until the circumcision is healed. And at first it's going to be really dark red at first, but then as it heals, it will become like a yellow. That's the granulation tissue. So we never want to remove that. That just means that it is healing and it is improving. So it is healing tissue. Have you ever changed a baby? Do you have any questions? I can show you that, of course. All right, so we'll just go over that really quick. Okay, great. Looks like you did a great job. If you want me to show you again, or I can check on anything for you, just let me know. You've got your call light. So I showed you how to change the diaper, making sure that you keep the belly button area open, and check for signs of bleeding and infections. So if anything, just give me a call. Let me know if you come up with any questions about the circumcision. And do you or Hendrik's father have any questions for me? And here is your call light. And congratulations on Hendrik's.